This is Kai Wheeler from KaiWheeler.com, and today I will be covering a topic I find to be shockingly under-discussed in the fitness industry, and that is myofascial release. Myofascial release is a manual pressure technique used to eliminate pain and restore mobility to restricted, dysfunctional muscle tissues. This technique is essential for any workout program because it directly relates to posture and injury prevention. When clients first come to me, in addition to conducting a posture assessment, I often ask them to tell me about injuries that they experience or aches and pains. And the most common problems I hear about are knee pain, hip pain, frozen shoulder, and back pain. Oftentimes, these clients assume that they have joint problems, arthritis, or even sciatica. But a lot of times they're pleasantly surprised to hear that their pain can be significantly minimized or eliminated by some myofascial release techniques. Pain in these areas are oftentimes referred from other areas that are the real culprit for the discomfort. So today I'm going to show you how to do a myofascial release technique that will help fix low back pain. We're going to be targeting the glute medius. Now the glute medius, the primary function is to keep your pelvis level during walking. Now, when the glute medius is overloaded by asymmetries that take place during activities of daily life, it can cause problems with your pelvis tilting downward, causing that anterior pelvic tilt, and discomfort compressing the lumbar spine. So let's get to how to relieve some of that tightness in your glute medius. All we're going to need for this is a mat and a ball, and the mat is your preference. If you want to stay on the hard ground, that's your prerogative. So first thing first, I'm going to show you where the glute medius is located. So the glute medius is below the belt line on the glute, the lateral side of the glute, toward the hip. So it's going to be pretty high up, but you're on the meaty part. You're not on a bone. So right about here. So what I'm going to do is I'm going to take my lacrosse ball. I'm going to angle my body, position myself so that I have that spot right below the belt line on the lateral side of my glute, directly in contact with the lacrosse ball. And I roll around until I feel the tender spot, because it's going to feel a little tender, especially if it's your first time. Now, if you can see that my feet are sort of, together in this position, this is just what's comfortable for me. Everyone sort of takes on their own style of doing this, whatever's comfortable for you. So you want to move around and go slightly to the right and the left of this trigger point, wherever it's tender, and just stay there. So you don't have to roll back and forth constantly, just kind of hang out and allow the lacrosse ball to break up that tight fascia. So I would recommend doing this about 10 minutes a day on each side to start, and then progress from there, however much time that you have. You really can't do this for too long. I'd recommend doing it while watching TV, or maybe you're checking email, something like that, where you can just kind of lay there, you can still use your hands. What you should start to feel is some of the pain subside a little bit. It kind of gets a little numb. It gets easier and easier as you do it, but when you're finished, you should feel like you have a little bit more mobility in that hip region, and you should feel like there's a little bit of pressure taken off your lumbar spine. So hopefully as you keep doing it, you will feel less pressure on that low back. Thanks for joining me for this video. I'm doing a pain series. I will be doing other videos on myofascial release, and if you look back in my gallery, I do have a video on how to fix knee pain. That's a video on how to release that IT band to help take tension off that knee. All right, I'll see you next time. Have a great day.